Welcome to CareWise Senior, the channel where your health is the priority, your journey through aging is honored, and your well-being is our mission. Every day we bring you essential topics that matter most to seniors and their families, from preventive care to lifestyle tips to emotional and mental resilience. Today we focus on one of the most urgent medical issues worldwide: stroke. Many people think of stroke simply as a blood clot or a burst vessel in the brain. While that's true at a basic level, the reality is far more complex. Stroke does not affect everyone the same way. Age, lifestyle, genetics, and especially gender play a huge role. Men and women often experience strokes differently, and those differences can mean the line between life and death. Each year, millions face stroke globally. According to the World Health Organization, stroke is the second leading cause of death worldwide and the #1 cause of long-term disability. In the US alone, nearly 800,000 strokes happen annually, most in people over 65. Behind each statistic is a real person, someone's parent, spouse, or grandparent, whose life changes in an instant. And time is critical. Doctors say time is brain. Every minute without treatment, millions of brain cells die. Awareness and immediate action are essential. But here's the challenge. Awareness only saves lives if it includes the full picture, and too often the differences between men's and women's symptoms are overlooked. That's why today's discussion is vital. We'll explore what a stroke is, how it happens, and why it's a medical emergency. Then we'll compare symptoms in men and women over 60, look at recovery differences, and share prevention strategies. This isn't just about facts, it's about empowerment, about ensuring you or someone you love is prepared. By the end of this video, you'll know how to recognize a stroke, understand gender differences, and act with confidence in those critical moments. Let's begin by understanding what a stroke really is. A stroke is often called a brain attack. Just like a heart attack happens when blood flow to the heart is blocked, a stroke happens when blood flow to the brain is interrupted. There are two main types. The first is ischemic stroke, which accounts for nearly 87% of cases. It occurs when a blood clot or blockage prevents blood from reaching part of the brain. Picture a clogged pipe in your house, water can't get through, and the section beyond the blockage dries out. In your brain, those starved cells begin to die within minutes. The source might be cholesterol buildup or a clot that traveled from another part of the body. The second type is hemorrhagic stroke, caused by a ruptured blood vessel. Imagine that same pipe bursting, water floods everywhere, damaging not just the pipe, but everything around it. In the brain, this spilled blood increases pressure inside the skull, crushing nearby tissue. High blood pressure is a major cause, weakening vessel walls until they give way. There is also what's known as a transient ischemic attack, or TIA, often called a mini-stroke. Symptoms last only minutes or hours, then resolve. But don't be misled. There is nothing mini about the danger. A TIA is the body's alarm system, signaling a major stroke could follow if steps aren't taken. Sadly, many people ignore it because they feel better after. Why does this matter? Because the brain isn't just another organ. It controls everything: movement, speech, thought, memory. When blood supply is cut off, consequences ripple through every part of life. Some may lose the ability to speak. Others may lose mobility, vision, or awareness. No two strokes look the same, but all demand the same urgency. Act fast. Here's the sobering fact. Brain cells die at a rate of nearly 2 million per minute during a stroke. That's why doctors stress immediate action. Time truly is brain. But here's the twist. Men and women often show different warning signs, and that difference can delay diagnosis. That's what we'll dive into next. Men over 60 most often show what are called the classic stroke symptoms. Sudden numbness or weakness on one side of the body, affecting the face, arm, or leg. They may suddenly struggle to speak or understand language. Their words may slur, or they may not find the right ones. Sudden confusion, blurred vision, dizziness, loss of balance. These are red flags. Because these symptoms are widely recognized, men are often diagnosed more quickly once they arrive at a hospital. Fast diagnosis means fast treatment, and that can dramatically improve recovery. But here's the challenge. Men don't always act quickly. Many ignore or downplay their symptoms, hoping they'll pass. Studies show men are more likely than women to delay seeking help. They may not want to appear weak, or they convince themselves it's just fatigue. But hesitation is dangerous. Every minute lost means more brain damage. Doctors often use the phrase, "time is brain," and with men, delay is often the greatest risk. Imagine this. A man in his 70s feels his arm go weak and his words slur. Instead of calling for help, he sits down, tells himself he just needs rest, and waits. 30 minutes pass. By the time his family calls emergency services, critical treatment time is lost. What might have been mild now risks becoming permanent disability. This is why awareness is not enough. Action is essential. If you or someone near you shows signs of stroke, don't wait. Don't hope it goes away. Call emergency services immediately. Time is brain. Men are more likely to experience ischemic strokes, which are caused by blood clots or blockages in the arteries leading to the brain. After 60, risks accumulate from decades of lifestyle choices and medical conditions. High cholesterol, high blood pressure, diabetes, smoking, lack of exercise all play a role. Testosterone and other biological factors also affect how men's vascular systems age, sometimes making arteries stiffer and more prone to blockages. Unfortunately, many men also avoid preventive care. They skip routine checkups, ignore high blood pressure, or dismiss chest pain and dizziness. This pattern of neglect increases the likelihood of a major event. Another danger is transient ischemic attacks, or TIAs, so-called mini-strokes. These events often last just a few minutes, then symptoms resolve, but they are red flags. Nearly 1 in 3 men who experience a TIA will go on to suffer a full stroke if nothing is done. Yet many brush them off. Let's be clear. Prevention is not weakness. Real strength is facing risks head-on, getting regular screenings, and managing conditions before they spiral out of control. Schedule that blood pressure check. Get your cholesterol measured. Ask your doctor about your stroke risk factors. Recognizing the warning signs and acting on them is not just self-care, it's an act of love for your family and those who depend on you. Women, on the other hand, often experience strokes differently. While they can have the classic symptoms, they are more likely to present with non-traditional signs. Sudden fatigue, nausea, vomiting, hiccups, fainting, seizures, chest pain, shortness of breath, or even hallucinations. Behavioral changes, confusion, or agitation can also appear. These subtle or unusual symptoms often confuse both patients and doctors. Studies show women are significantly more likely to be misdiagnosed, especially in emergency rooms, when their symptoms don't match the classic stroke checklist. Another complication is that women are more likely to live alone in their later years, especially after losing a spouse. Being alone when a stroke occurs means delays in recognizing symptoms and calling for help. Biologically, women face unique risks. They are more likely to develop atrial fibrillation, a heart rhythm problem that increases clot risk. After menopause, dropping estrogen levels reduce vascular protection, raising the chance of a stroke. And pregnancy complications, even decades earlier, can leave a lifelong imprint on stroke risk. The tragic truth is that women are more likely than men to die from a stroke and more likely to suffer long-term disabilities when they survive. These include mobility challenges, speech difficulties, and cognitive decline. For women, the difference in symptoms and risk factors means education is even more critical. Awareness saves lives, and too often, women's symptoms are dismissed or misunderstood. Why do these differences exist? They're not just social, they're biological, hormonal, and neurological. Women's brains are wired slightly differently than men's. Estrogen, for example, has protective effects on blood vessels. After menopause, as estrogen drops, that protection weakens, making strokes more likely. Women also metabolize medications differently, which can affect how they respond to clot-busting drugs or blood thinners. Studies suggest brain structure differences may affect how symptoms present and how recovery unfolds. Social factors play a role too. Women are more likely to prioritize others' health before their own. As caregivers, they may ignore their own symptoms until it's too late. They're also more likely to live longer and thus face stroke risks in advanced age when they may be more isolated. Another factor is how pain and discomfort are reported. Men might say, "My arm is numb." Women might describe, "I feel off," or "something isn't right." This difference in communication can lead to confusion in emergency care. The bottom line, we must understand both the biology and the social context. Stroke education must reflect these realities so that both men and women get timely, accurate care. Here's the hopeful part. Many strokes are preventable. Prevention begins with awareness and small, consistent steps. First, monitor and control your blood pressure. Hypertension is the leading risk factor for both ischemic and hemorrhagic strokes. Second, keep cholesterol and blood sugar in check. Third, quit smoking and limit alcohol. Fourth, exercise regularly, at least 30 minutes most days of the week. Fifth, eat a heart-healthy diet rich in vegetables, fruits, and whole grains, while cutting back on salt and processed foods. Sixth, get regular checkups. Don't wait until symptoms appear. Finally, know your family history. If stroke runs in your family, your risk is higher and you need to be especially vigilant. And remember this acronym, BEFAST, B for balance, loss of balance or dizziness. E for eyes, sudden vision changes. F for face, facial drooping. A for arms, weakness in one arm. S for speech, slurred or strange speech. T for time, call emergency services immediately. BEFAST is simple, but it saves lives. Share it with your loved ones. Prevention is not complicated, but it requires commitment. Small daily actions can protect your brain, your independence, and your future. Recovery from a stroke is not just physical, it is emotional, mental, and social. Rehabilitation can take months, even years, and it requires resilience and support. Physical therapy helps restore strength and movement. Occupational therapy helps patients relearn daily tasks like dressing, cooking, or writing. Speech therapy supports those who struggle to communicate again. Cognitive therapy works on memory and problem solving, but recovery is also about the heart and mind. Men often struggle with the loss of independence, while women may struggle more with loneliness or depression, especially if they live alone. No two recoveries look the same. Some regain abilities within weeks, others require years of hard work. Small victories matter. Moving a finger, saying a word, walking a few steps. Each step forward is worth celebrating. Support systems are vital. Family encouragement, caregiver dedication, community programs, and professional counseling all play crucial roles. And don't forget, emotional healing matters as much as physical healing. Survivors often deal with fear of another stroke, changes in self-identity, or frustration over lost abilities. But with time, therapy, and support, recovery is possible. Stroke is not the end. It is a new chapter. If there is one message you take away today, let it be this. Strokes don't discriminate, but their symptoms, risks, and outcomes often differ by gender. Men may experience the classic signs, while women may have subtler, confusing symptoms. Men may delay getting help, while women may face delays in diagnosis. These differences matter. Awareness matters. Action matters. By recognizing these unique patterns, we can save lives. Education is powerful. When families know the signs, they act faster. When doctors understand the gender differences, they diagnose more accurately. When communities spread awareness, more people survive and recover. Stroke is a leading cause of death and disability, but it doesn't have to be inevitable. Knowledge and prevention are within our reach. Share what you've learned today. Talk to your parents, your spouse, your friends. Make sure they know the signs of stroke and the importance of acting fast. One conversation could make the difference between life and loss. This video is just the beginning of a larger conversation. Prevention and awareness must be daily habits. Visit our website, carewisesenior.com, for resources, including a free checklist to help you track your risk factors. Subscribe to our newsletter for expert advice on healthy aging. And most importantly, join the conversation. Share your own stories of stroke survival or caregiving in the comments below. Your story could inspire others and even save a life. Remember, prevention doesn't start at 60, it starts now, at any age. The choices you make today, diet, exercise, medical checkups, will protect your future self. Stroke doesn't wait, but with preparation, you can face the future with confidence. Let's raise awareness, fight stroke together, and age not just longer, but stronger. Thank you for watching CareWise Senior. If this video helped you, please like, share, and subscribe. Join our community of informed and empowered seniors, caregivers, and families. Remember, your health is our mission. Aging is not the end. It is the beginning of a powerful new chapter. Stay strong, stay aware, stay CareWise.